Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. We are recording on January 22nd, 2026, today to talk about the latest legal goings-ons for Epic Systems. We have Gabe Perna, digital health editor from Modern Healthcare, to discuss. Gabe, welcome to the program.
Yeah, thanks for having me. I'm really excited to be here, Jeff.
Yeah. So for those that steeped in Epic lore, it's probably one of the more successful American business stories that you may or may not know about, depending if you're in the healthcare space or not. Can you give listeners a little background into the company? So they may know it's an EHR company, but I have to imagine some probably aren't aware of the size and scale.
Yeah. I think people would be surprised at how big Epic is, especially if they're not in the medical field. They are the largest electronic health record EHR company in the U.S. and likely the world. I don't do as much research into what's happening outside the U.S., but this U.S. health market's the biggest, so I would imagine that means Epic's probably the biggest in the world. It was founded nearly 50 years ago by a woman named Judy Faulkner in her basement alongside two other part-time employees. And it was a very similar to like Apple and some of these other companies like rags to riches, starting out with humble beginnings. Judy likes to say, I think it's like $70,000. It was the only investment she ever took in the company at the beginning. And over time, it's just grown to be this monster, this, huge company that is in, nearly almost every hospital. The chances are, if you've been to a doctor, you are in the Epic system. I know on their website, it says 325 million patients. So if you think about the population of the U.S., and they do have some international customers, that's a lot of people in this country who are in the Epic system one way or another. Maybe it's through the hospital, maybe it's through your local provider, but they are everywhere and they have grown over the years. I think according to the most recent Class numbers, Class is a research company that looks at market share. They are in 42% of acute care hospitals and 55% of acute care beds. That was by the end of 2024. And I know for a fact that that number has grown since then. Their size is a little bit part of what we're going to talk about today. And it is a big company. I think they do approximately $6 billion in revenue. They're a private company, so it's not as easily known as a public company. But I think those estimates are pretty, they've been out there for a while. That's around what they make in revenue, which is, that's pretty sizable. And I think
a lot of hands in healthcare honeypots.
That's a lot of hands you're absolutely right. And I think that would make them interesting enough if that was kind of it. They were just this large EHR company. But what really makes them interesting in the lore that you talk about is kind of like who they are as a company. They're located not in San Francisco, not in Boston, not in New York, but they're actually located in Verona, Wisconsin, which is just outside of Madison. And they have a very, I would say, interesting headquarters. It's unlike any other headquarters I've ever been to. It's not like just a bunch of drab gray buildings and maybe some park benches. They have themed buildings, and the themes are kind of there's one that's like Storybook. There's one that's like Clue. There's one that's like Dungeons and Dragons, science fiction. It's all kind of interesting themes like that. There's a Harry Potter element to it. I know that comparison has been made. I went there for the first time last year, and it is as interesting as everyone says it is. There's a giant carousel. There's a working farm for their big event, which is called UGM. It's their big user event. They had horse and buggies kind of trotting around. So it's nothing like you've seen in terms of headquarters. And I think that quirkiness reflects on Judy, the CEO, who's been there since the beginning and has, kind of been this larger than life figure in health tech because of how powerful Epic is and because of that quirkiness.
So without breaking NDA, What was the spread like then?
It was, when I go to these events, I'm there on business. So it's hard for me to sit there and enjoy it. I did take pictures. I had young kids, so I definitely was I have to show them what this looks like. And I even said to the people there, I was like, I would take my kids here on like weekends. Like, not that, I'm sure they don't, no one wants to be at work on weekends, but it's just like so interesting and fascinating in terms of like the buildings and the structures. Like they have Rapunzel's hair. They have a tower with Rapunzel's hair, and you like walk up the stairs past Rapunzel's hair. So that's kind of gives you an idea. It's a very interesting headquarters, and UGM's an interesting event because you have all these hospitals coming, all these like tech people in hospitals coming, and they just go all out. Some of them like dress up, they cheer. I mean, they're hardcore evangelists for the company in a similar way to what you would see with Apple. I think that's the best comparison you can make on like consumer tech. And there's always a theme, for each event. And Judy always dresses up for the theme. This year it was science fiction, so she dressed as like an alien. So hopefully that gives people an idea of how quirky the whole thing is. So it's just an interesting dichotomy because you have this company that's worth 6 billion, and in many cases has been dominating the EHR market, while many of its competitors have struggled. There's been accusations. Some companies have said Epic doesn't play nice with third-party vendors, and I think we'll talk a little bit.
Yeah, let's get into that. So
Yeah.
last month, Texas sued Epic. The state of Texas
Yes.
sued Epic, accusing it of being a monopoly. I'm not going to be able to say monopolistic practices well right there. Okay, but I just did. What are some of the details and why Texas?
So they basically are alleging Epic is in violation of the Texas Free Enterprise and Antitrust Act by maintaining monopoly power in the acute care hospital EHR market. And boiled down, because it was a long suit, they basically say that Epic runs an anti-competitive playbook. Now, keep in mind, these are all allegations. So, this is not me saying it. This is not necessarily the truth. This is just what Texas Attorney General Ken Paxton is alleging. He alleges that they run an anti-competitive playbook in which they delay or prevent potential third-party health tech competitors from accessing customers' patient data and acting as a gatekeeper. So what I just said, I mean, like, there are these accusations that, like, if you're a third-party vendor trying to create some kind of solution in healthcare, let's say clinical decision support, let's say AI ambient scribing, the accusation is like that in order to get the customer's data, you have to go through Epic because Epic is the EHR of choice for most hospitals. And what the allegations are is that Epic does not make that easy. They make it really hard for these third party vendors to access the data. So that in itself, Paxton and Texas are saying that is an anti-competitive monopolistic behavior. But that's not it. There's also allegations that they coerce hospitals into using Epic products rather than the third-party applications by imposing fees on those hospitals. They also allege that Epic smothers new health tech entrants by forcing their employees to sign non-compete agreements that prevent them from leaving a competitor for at least 1 year. And then there's allegations that Epic restricts parents from viewing their child's medical record in violation of Texas state law. Now, that last one, you asked why Texas. That last one is why Texas, because Ken Paxton, who filed the lawsuit, has made a broad plan to stop EHR vendors from restricting parental access to minors' medical records. Obviously, this is like a big touch point for a conservative politician, and Epic has kind of been caught up in the middle of it. But at the same time, he's throwing out some of these major allegations about how Epic runs this quote unquote anti-competitive playbook. So it's a pretty wide-ranging lawsuit that Epic is facing here.
So what's the merit in this suit? So Epic, I know, has seen some similar suits from Curis Healthcare and Particle Health. What's going on?
First off, I just want to say, and I'm sure anyone would say, I'm not a lawyer, and it's hard to say like what the actual merit is in this suit. But these are allegations that have been thrown against Epic privately, and as you said, in other lawsuits. So I would say it's not like this didn't come out of nowhere. In other words, like this isn't something that like Texas has, in their minds, like they've heard this before, and that's why they have all those different allegations on top of the parental thing. So you mentioned Curis. Curis filed their lawsuit in May of last year. They accuse Epic of engaging in anti-competitive behavior and blame Epic for the loss of several customers. What's actually interesting is this was mentioned in the Texas lawsuit. Like they kind of lead on this Curis lawsuit in Texas, and they actually give an example of that. Epic required one of Curis's customers, Hill Physicians, to stop discussions with Curis because Epic believed that it had a tool or a service that overlapped with Curis. So that was Curis's. And then you mentioned Particle. Particle's a little different. Basically, Particle has a platform that connects providers and health tech companies to patients' records. They allege that Epic is using its power to prevent products that would compete with the company's payer platform as an Epic's payer platform. And that Epic is restricting patient data access. Epic has requested to dismiss this case, and actually the judge did dismiss some claims, but kept some of the others. So the case was not fully dismissed. It was partially dismissed. And I actually spoke with the Particle Health CEO, and he said this is the farthest an antitrust case against Epic has gone. So we'll see what happens with those other ones. I would say the Texas one, I mean, that has the power of a state behind it, and not just any state, but Texas. It's a huge state. And I know that, I don't follow the attorney general in Texas, but I do know they file a lot of these lawsuits and get a lot of settlements. I think this one bears watching. I think this one could be tough. The other ones, I think, just face longer odds. They're smaller companies kind of standing up against this behemoth. Whether the allegations are true or not, and we'll talk about Epic's response, but it's just going to be hard for them to kind of win based on the deck being stacked up against them.
Yeah. So how has Epic responded?
So yeah, I mean, first off, in all suits against them, Epic denies the claims. I want to get that out there. I know Epic, might be listening, and they deny all the claims. We'll start with Texas because they actually filed a response this week in Texas court, and basically they said the claims are baseless and pretextual, as in like it's a dubious kind of assumption that Texas is making, and they actually go through a lot of the charges that Paxton makes and try to dispel them. One that I thought was interesting, I'm actually going to quote directly. So this is a quote from Epic in their official response to Texas. Although there is nothing in antitrust laws that requires Epic to lend a helping hand to other companies that are trying to compete with Epic, Epic's desire to promote interoperability and better meet its customer needs, among other reasons, has motivated Epic to create multiple access points for customers to integrate Epic software with third-party applications. And basically they're saying, they're actually a leader in interoperability, even though they don't have to be. That kind of line, like, we're not actually required to do this, but we do it anyway because our customers ask us to do it. And they say, the very mechanics of Epic software, talking about these APIs, negates the state's gatekeeper allegations. So that's a big part of Epic's response is like, even if we want to, the way we've set up our EHR negates these allegations. And they also go through the non-compete allegation that Texas made, basically saying that, yes, they do have some non-competes, and, it allows them to make sure that their intellectual property and it won't get taken advantage of. And they basically said that the non-competes that Texas cited were old and that they only applied to a subset of employees. And then on the parents having, access to minors' records, they deny that and say Texas actually never identifies a single instance of reported noncompliance. So they said they're going to file a separate motion to dismiss, although interestingly, they didn't do that yet as of the 22nd. So, we'll see when that happens. But and then they're denying the other claims as well. But again, I think, the focus on Texas, because of it is the state of Texas, it is the one that I'm probably going to pay most attention to.
Yeah. So putting you on the spot here, but what are the implications of the Texas case?
I think if this was successful, it could change the way that Epic shapes its contracts. It could shape the way that they deal with some of these third party vendors. I think, and that's a huge if, by the way, Jeff. I mean, like, we have to see what happens. There could be, a settlement, or Epic could get it dismissed and win outright. But let's say they do kind of successfully prove their case, as in the state. I think it could change the way that Epic is forced to write contracts with some of their customers. And I think it does put a dent. It would put a dent in kind of like maybe this invincibility that Epic has around them. Like, this is this big company that has really dominated an important part of our healthcare industry, and they're somewhat untouchable. If they lost a high profile case like this, it could put a dent a little bit. I mean, Epic will be fine. They're entrenched, and Texas actually talks about this in their allegations that they're entrenched with so many of these hospitals, because it's just too expensive for hospitals to switch from Epic, and that's why hospitals don't. I mean, there's again allegations, but this is why hospitals end up going with Epic a lot. It's just because they don't want to pay the cost to change it. So I think Epic is a behemoth, but yeah, I think if this does go through, it could put a little dent in them for sure.
Yeah, I guess I was just trying to you set up how many like covered lives they have in the beginning, which is a lot, and they're a big company. I'm trying to like just tie a thread of like, if I'm a person that, an academic researcher that like kind of knows who Epic is, like, why do I care about this lawsuit? That's all this, or like
Yeah.
what might it matter to me, kind of thing.
I mean, like, there are people out there who want to see Epic broken up, and I think that would have massive. I mean, that's a huge if, and I don't think that will happen. But like, let's just say, hypothetical scenario that would have massive implications for everyone: researchers, clinicians, anyone who works in the healthcare system would be affected by that, happening. Again, I think that I'm not a lawyer, so I don't want to predict anything.
That's right.
Well, like, I feel confident predicting that's not going to happen.
Yeah.
I think
we're not financial analysts. We're not lawyers.
No. But I don't think Epic's going to get broken up. I think, if anything, it comes down to like, maybe they have to change some contractual language. But even that, we'll see what happens. I mean, we're still in early innings. And I don't think Epic's going to back down anytime soon, and I don't think Texas is going to back down anytime soon. So this could play out for a while.
All right, and we'll have to have you back on when more movement happens on it. As we kind of wrap up, I did have like two quick questions since you're embedded in the digital health space. Just quick question, like, what was your take on ChatGPT entering healthcare? What have you been hearing?
Yeah, it's interesting. I mean, it's an exciting time to see companies like OpenAI, Anthropic, these big, massive AI companies get into healthcare. But as you know, I mean, like, they're not the only ones who have tried this. Apple, Google, Microsoft, all these guys have tried in some
Hathaway,
regard.
JP Morgan.
Yeah. Like, they've all tried in some regard to get into healthcare. I think what OpenAI, like, their advantage is that people are using this for that. They already kind of have the scale that others have wanted to get. People do use it for medical reasons. I have no doubt about that. I think what's going to be hard for them is winning over like the provider audience, whether it's the health systems and hospitals themselves, whether it's the doctors themselves. I know a lot of doctors use it, especially younger doctors, med residents, like OpenAI. They like Open Evidence, which is another AI company. They do like using those, but I think you still have to win some hearts and minds there. To really make the impact that you're looking to make. Because at the end of the day, yeah, some people might use it on their own to get medical advice, but I think a smaller number are going to use it to actually like shape their medical care. If you want an actual treatment or a medication, like, I think you're still going to go to your doctor, right? I mean, I think you still need to like have a relationship. And to OpenAI and Anthropic's credit, they both know that. They both are partnering. I know OpenAI has a partnership with Boston Children's. Anthropic has a bunch of partnerships, I think, with Banner. So they both know that. And I think that will be the key to their success is winning over the hearts and minds of the incumbent healthcare system.
Right on. So last question. Who do you think is going to be the first boot on Survivor 50?
It's a great question. I mean, it's always like the bigger people, like the bigger characters, right? Like, unfortunately, they do these seasons and then it's like, oh, someone I like got booted. So I feel like it's going to be like Coach or someone who like you want to see versus like maybe a more under the radar player that you're like, I could go without. So I'll say Coach, but
okay.
Yeah, I if you're a Survivor fan, I'm warning you now. I feel like you're probably going to be disappointed with how this season goes because that always happens with these all-star seasons. It's like the big names get dropped early because the under the radar players want to make their own name. I feel like that was the case in the first ever all-star season, and it's been the case like since.
Yeah, I'm going to throw, I think depending on the tribe, it's going to be either Genevieve going out or Charlie.
Charlie, yeah. Well, winners for sure, I think, are going to get targeted. I mean, like, that was weird that I thought they only had a few winners. Like, I feel like those people are dead meat. Kyle is another one that I'm like, you're probably not going to last to the merge just because you won. But we'll see. I mean, who the hell knows?
Yeah, time will tell. Time will tell.
Time will tell.
So, last question. Is there anything that you want to promote on what's going on in modern healthcare?
Yeah, I mean, like, we're always doing interesting stuff. Covering the insurance hearings today, which probably will be too late by the time this comes to air. But, a lot of interesting coverage in DC these days. On the digital health side, we cover the big events, so we'll be there. Yeah, I mean, I always say if you got an interesting story, hit me up. So that's true, for anyone listening. If you think you got an interesting story, hit me up, gabriel.perna@modernhealthcare.com, or I'm on LinkedIn. So, yeah.
Well, fantastic. Gabe Perna, thanks again for joining us today on Health Affairs This Week. If you, the listener, enjoyed this episode, send it to the self-made billionaire in your life, and we will see you next week.